Every year around this time, the Federal Minister of Health tables a report to Parliament on the Canada Health Act and how closely provinces and territories are adhering to it. This is the law, the Canadian law, that bans user fees, extra billing, and other barriers to universal physician and hospital care across Canada. Some provinces won't report on all categories. The federal minister probably won't say anything, and we predict there will be silence regarding the sell-off of Medicare that's happening throughout our country. There's an absence of leadership and certainly an absence of accountability. Canadians expect their governments to defend public health care. The Harper government has been silent on this policy issue, one of their 5 key promises when they ran for election in 2006. Doing and saying nothing effectively undermines Medicare, and the silence must stop, which is why we're here today. Linda.
Bonjour, j'adressais vos questions en français par la suite, s'il y en a. It's important to remember what's driving this campaign is not the legal status or acts of Parliament. It's patient rights and rights as we have as Canadians. Governments will say we won't do anything if there's no complaints. And honestly, Health Canada doesn't even have a complaint mechanism. Your Medicare Rights is being launched to respond to the lack of leadership in healthcare by this government and to defend patients from greed.
Well, the federal government has 2 obligations under the Canada Health Act. The first is to report to Parliament, and the other is to enforce the Act. And as Paul explained, it's doing neither. And Linda's described how this is playing out for people across the country who are increasingly being asked to pull out their credit cards when they seek necessary health care services. When that happens, the requirements of the Canada Health Act with respect to accessibility, which means no financial barriers to access to necessary care, the ban in the Act on extra billing and user charges are being offended.
If we don't defend case by case, citizen by citizen, people's rights, those rights will be lost. But we also think Canadians are increasingly frustrated when they're told they might have to wait 2 years or they can pay $1,000. They shouldn't have to wait, and they shouldn't have to pay $1,000, and they should assert their rights.